Hi, happy Sunday. It's February 16th, 2020. It's a week since my last post on coronavirus, now known as COVID-19, a new viral designation, which we're going to talk about. I'm going to try to do weekly updates on the coronavirus situation because I think it's going to evolve and worsen, unfortunately, pretty significantly over the next 4 to 8 weeks, but maybe I'll be lucky and we'll all be lucky and I will be completely incorrect. But based on disease modeling and all kinds of other things I've been reading, unfortunately, I think we have a lot to be concerned about. So the first thing to go over is last week, 7 days ago, there was approximately 37,000 infected people in the world and roughly 815 deaths. There was also about 380 infected people worldwide. Let's jump forward a week and we have 71,500 infected worldwide, and most of those are in China. And so then out of China, which is what I meant to say on the last part, we have almost 600 people plus infected out of the country of China. So pretty startling changes there. And we have about 1,700 deaths at this point too. So in 1 week, the entire statistical numbers on the COVID-19 have doubled, which is not a good sign for how the disease is going to go. One of the reasons the disease numbers changed was the Chinese government decided to open up slightly the diagnostic criteria for the virus, which was a little late in coming, but I'm glad they've done it to give a slightly more accurate number as to the people who are affected by the disease. I don't think the numbers coming out of China, though, are anything close to accurate, but we at least are getting something that may be a little better. So let's talk about other things that have happened. So a week ago, I was pretty concerned about the virus, and that's why I wanted to do a post to get the news out about zinc. Well, as this last week progressed, several different things happened that has highlighted my concerns and should highlight everyone's concerns. First and foremost, disease modeling estimates using computers, which are pretty advanced to do this stuff, project a minimum of at least 300,000 people to 4.4 million people infected. Those are minimal numbers. Those are not maximal numbers. There's some projections in terms of maximums that I don't even want to go over because they're so abysmal. But so we're looking at a minimum of 300,000 to 4.5 million people are going to be infected by the virus. If we look at case fatality rates, it's running about 2.5% roughly. One thing to keep in mind about case fatality rates, though, is a lot of the people who get infected don't get sick enough, and it's the vast majority to even register as a statistic. So when I'm talking the 300,000 or the 4.4 million, a lot of those people are never going to even get sick enough to notice. It looks like about a third of the people plus who get the virus get sicker. So when you get sicker with the virus, who needs to be worried about it? Well, that data is starting to flesh out a little bit. So if you're older, it's a problem. If you're over 80, it could approach 1,000% increased risk of death compared to someone under 50. If you're 70 to 80, it's super elevated. If it's 60 to 70, it's very elevated. And then secondly, comorbidities. Comorbidities just means other diseases going on in your body. So if you don't have any comorbidities, it means you don't have any other disease things that are happening. But if you have comorbidities, they can affect your immune systems and affect your lungs or your heart. So things that ratchet up the effects or the probability of getting sicker with COVID-19 is if you have heart disease, if you have lung disease, if you have diabetes, if you're on anything that modulates your immune system, so things like biologics for arthritis, active chemotherapy, immunosuppressants for transplant, all of those people are going to be at a higher risk for problems if they get the COVID virus. People who've been exposed to chemotherapies or radiotherapies in the past for cancer are also going to have a much higher risk of disease events. And if you combine those comorbidities to age, then the disease event is a much bigger deal. So something to keep in mind. If there is any good news about COVID-19, it does not seem to be picking off younger people. So if you imagine a predator and a herd analogy, it's just going after the old and maybe the weakened, but young, healthy people and children look like they're pretty darn resistant, which I think is great news for all of us who have children. And if you're lucky enough to have grandchildren, it's wonderful. So that's a positive, because the flu virus back in 1918 would pick off younger people. So we always have to wait and see. So when we start looking at this, what else has happened? Well, on Friday, the Center of Disease Control, the CDC, whose name's Robert Redfield, and he's the right guy at the right time. He's an internationally acclaimed expert on viral diseases and HIV transmission, is now in charge of the CDC, so we couldn't have a better person. But he went through something that's very important for everyone to understand. He talked about containment and mitigation. And so when you have a virus that's spreading, there's generations, or how far has it spread across a group. So if you look at someone who got the virus from the original infection site at the Wuhan market, that would be a first generation person. If they go home and give it to their friend or a significant other or a child, that's a second generation. And so when you think about containment, successful containment of epidemics have to occur about at the second generation, because as you get into the third generation, which is when that person at home then goes to school and gives it to someone else, or the wife goes to a movie with some friends and gives it to the popcorn server, those people start to get far out and they're hard to contain. And then if that person who got it as a third generation gives it to a fourth generation, another person, there's no containing it. So when we look at COVID-19, as Dr. Redfield said, we're definitely in the third to fourth generation. And his kind of paraphrasing what he said is, we're only doing the containment to slow the mitigation phase, because they know pretty certainly it's going to spread everywhere now. And so they want to delay the mitigation phase so they can have everything in place to try to help people. The mitigation phase means you're just trying to mitigate the disease, and the cold, hard truth of that is you're trying to limit the number of dead people. I mean, that's all that means. No one's going to say that as bluntly, but that's reality. So when you think about mitigation, what can the CDC do to help us? Well, they're going to say keep your hands washed, potentially wear a mask. That's all they're going to say. If you look what China is doing to try to mitigate the disease, it's like putting lipstick on a pig. One, they've reported doing plasma transfusions from people who've improved back to patients who are still sick, and said that it may have helped, but that's about as scientifically valid as, I don't know what, I can't think of a good analogy. They've also suddenly released an antiviral from Japan that's in testing and says this could be effective for COVID-19. They have no idea. And again, both of those plans, which is typical medicine plans, are treat it once you get it. So the horse is out of the barn, you're already in trouble. So what do we really need to focus on for mitigation strategies? Again, which will not come from health organizations, because health organizations follow normograms and they don't read the medical literature, which seems incredible to me. The number one thing to do, I'm going to tell all of you, is take zinc gluconate, 50 milligrams a day. If you're a high-risk person and the COVID gets to where you are in the United States, you probably need to go to 50 milligrams twice a day minimally. And then there's a second thing that's really important, which I didn't mention last week, because I wasn't certain we were going to need to start going over this stuff, but we are, is let's talk about cellular nutrition for a second. Can we make cells work better? And the answer is yes. And so there's a particular vitamin that's called Mitocore. We carry it at our office, called MitoStrength, that was originally went through phase 1, 2, and 3 trials for AIDS patients. And if you take 4 of these vitamins a day, you increase your T4 helper cells by 24%. So if you increase your T4 helper cells by 24%, that increases your lymphocytes, which are the kind of white blood cells that fight off viruses and fungus. So if you do a combination strategy of higher zinc, so your alpha interferon's way up, you're taking the right potent multivitamin, and you can increase your lymphocytic attack, your immune system's revved up and ready to fight the virus if it comes into your community, and then you will more likely, in theory, be resistant to it or only have minimal symptoms or not even know you have it. If you don't have those things kind of all in tune as the infections start to spread, you are going to be at higher risk for getting quite sick. So that's a strategy for kind of prevention and limiting disease event, or actually mitigating the disease ramifications, versus just kind of waiting and hoping that by washing our hands and doing masks, it will help. So just something to keep in mind. We carry those things at our office, and you can go to our website, Optimal Health Associates. You can also look for similar things online at different sites. So that's the update on the virus right now. We'll see how it goes this next week. I think in 2 weeks to 3 weeks, we're going to have a really good idea of how dangerous this is, because they did the Petri dish experiment on those people on that boat, which again was calculated. I don't want anyone to think it wasn't. Suddenly, once there were 250 people on that cruise ship off in Japan who were infected and brought to the hospital, suddenly we could offer them getting off the boat, which I thought was kind of whimsical. They could have done that at 180 or 150. But so now they're offering people to go home if they want to different countries. But the key thing with that is we now have 250 patients in a first-class Japanese hospital being monitored very closely. So we're going to get a lot better idea of what happens to people with the disease from the get-go. And that will be quite helpful for all our healthcare experts too. So that is all for February 16th, 2020. Have a wonderful week and take care.